So this is the agenda for today. So we have got Danilo, who's going to be speaking after I give a brief introduction to the project. Danilo is going to be presenting on the research findings, the guidance manual document, the evaluation document. Then Mo is going to present on the buy-in document, and Josh is going to present on the participant booklet. I'm then going to give a very brief overview of our next steps before we have Q&A at the end. So there's quite a lot to get through today, but we really hope that you enjoy it and you get something out of the session. So thinking about the project content and the topic, I'm sure that a lot of you are aware that there's increasing awareness that nature-based programs or green space programs can be effective in supporting people's mental health. But we are also looking at if they can be effective in supporting people with drug and alcohol problems. So this focus is really important given that there's high levels of drug-related harm in the UK. We really need to think about new or innovative ways for supporting a range of different people that are experiencing complex challenges while limiting rising costs. So over the past 2 years, we've led a Chief Scientist Office funded research project looking at nature-based programs for people with poor mental health and experience of substance dependence. And we're looking to build both a theoretical framework, which really explains how and why these programs are effective, but we also want to move this framework into practical guidance that could allow new programs to be set up with the best chance of them actually being effective. So Danilo is going to go into the project in a lot more detail shortly and really give you insight into the work that we've done in terms of building that framework. And both he and the other speakers today are going to show you the guidance manuals that are on the slide here. But I really just wanted to give you a brief snapshot of these. And show you what we're going to be talking about today. So the one in the middle is the main manual, which provides the detail around key considerations in how to set up or how to refine programs for people with poor mental health and substance dependence. The one on the right is the evaluation guidance document. This one explores how best to measure outcomes and show the benefit of programs. And then the one on the left is the buy-in referral document. So that's designed to support these initial conversations between the potential participant, referrers, link workers, support workers to really achieve this initial engagement enthusiasm, particularly among people who might be more hesitant to get involved with this type of approach. And it's not guidance for a specific referral pathway, but it does contain key information about the type of conversations that can happen. So we'll be sharing these documents with you after the session, along with the document that's developed for participants themselves to track their own progress. And Josh is going to be speaking about that document. So I'm going to pass over to Danilo now, who's going to go through all of this in more detail.
Thanks, Wendy. I will just share my slides quickly. Okay, can everyone see just the slides and not the presenter notes?
Yeah, that's good, Danilo.
Okay, cool. So hi everyone. I'm so glad to be here today and to be chatting to all of you. And as Wendy said, I'll be giving a bit of an overview of the research project that we've been doing, as well as the outputs that we've produced from it, which Wendy's just touched on. So as Wendy said, I'll be kind of chatting about two main outputs today. Once I've given a bit of an overview of the project more broadly. So the first will be the main green space guidance manual, which is really our primary output and really outlines how green space programs can be designed and implemented to effectively support those experiencing substance use and mental health challenges. And then the second document is our outcomes and evaluation briefing. And this outlines some of the key considerations around how programs can kind of evidence their impact. And I'll touch upon that more shortly. So before we get into discussing the current project, it's worth presenting a wee bit of background information about the theoretical information which has really informed the development of these documents and the project more generally. So the current project builds upon previous research undertaken by Wendy during her PhD, and that was kind of developing a theoretical framework for green space programs supporting this population, how they could do so effectively in an evidence-informed manner. And this work used a realist approach, and I'll touch upon this in the next slide. So our aim was to refine this existing framework and to develop it into something which was kind of more practically grounded and really helpful for informing the delivery of green space programs on the ground. So I mentioned the realist approach there. What is that? Broadly, it's kind of an approach which is really very sensitive to context. And it says that just because an intervention or program works in one setting, it can't be assumed that you can just transfer it to a different context and it'll work in the same way, because there's a wide range of factors which shape how a service will work. And a good phrase to encapsulate this is, instead of asking what works, a realist approach asks what works for whom and in what circumstances. And a key part of this approach is to identify the relationship between context, mechanisms, and outcomes. So contexts are the individual, interpersonal, cultural, and social factors which can impact on the delivery of a program. Mechanisms are components of a service or program which are often difficult to observe, such as emotions or kind of social dynamics. And mechanisms occur when particular contexts are in place. So, for example, participants building trust with staff or feeling involved and valued, these are examples of mechanisms. And these might happen because of context like a supportive group environment or caring staff. And then finally, outcomes are, of course, things which happen as a result of a program being delivered. And when we combine particular context, mechanisms, and outcomes, we get something called program theories. And program theories specify how particular contexts can mean certain mechanisms happen, which then make certain outcomes more likely. So they're really theories about how a program works and how it can be effective. Program theories are present throughout our manual as we've used this realist-informed framework, and they're expressed in the manual as if then leads to statements. So if relates to relevant context, then refers to mechanisms which happen because of these contexts, and leads to are the outcomes which are then more likely to occur. So shortly, I'll go through slides which share sections of the manual in more detail, but I've provided a wee example here just to get us kind of started. So this is one of the first program theories in the manual, which we've called escape and getting away. And it's about the sense of escape, of course, that people can experience through connecting to nature on a green space program, and kind of how this can impact on their well-being. So the contexts are accessibility of a program, sensory stimuli like birdsong and running water, and knowledgeable staff. Then, if these contexts are in place, the mechanisms should happen like wonder and awe at nature, participants feeling removed from daily stress and feeling calm. And these mechanisms can lead to outcomes like improved mood, reduced stress and anxiety, and increased connection to nature. So, although the original framework that we're working with has been developed rigorously and robustly, there were some gaps which remained, and this is where the current project has kind of aimed to pick up and address these. So, the first aim was to ensure that the voice of those with experience of problem substance use and mental health challenges was really central to our framework and our guidance. Secondly, we wanted to build more guidance around pre-program planning and post-program support to ensure that the guidance took people right from the initial phases of planning and then to what happens after a program and everything in between. And then lastly, we wanted to build more guidance around evaluation and outcomes. And as I said, I'll kind of discuss that in more detail shortly. So this slide is just to kind of highlight that our key aim was really to move the existing theoretical framework into something which could be valuable for informing practice and providing guidance on the ground around how to deliver green space programs in a really evidence informed manner. And when we kind of go through the documents in more detail, hopefully you'll get a bit of an idea of how we've done this. So I'll now provide some information on the methods and approach we undertook when we were developing the manual and the framework. And this has involved two distinct work packages. In work package one, we conducted interviews with a range of stakeholders, and the focus of the work package was to test and refine the existing framework with particular attention to the gaps which I highlighted on the previous slide. And we used this to develop our first draft of the kind of documents that we'll be discussing today. And then in work package two, we conducted further interviews with stakeholders, and we were seeking specific kind of feedback on the manual draft that we'd developed. And we also asked participants their views on the feasibility and acceptability of a range of evaluation methods in order to develop our outcomes and evaluation briefing document. In terms of data collection and methods, in total between the two work packages, we conducted 80 one-to-one interviews. We also conducted 4 focus groups with a total of 17 participants, and these were individuals experiencing drug and alcohol challenges who had no previous experience of green space programs, just to ensure a kind of balanced and rounded perspective. We also conducted a number of participatory site visits to a conservation program operating in Aberdeenshire, and this offered the chance to see how a really effective program worked in practice, to recruit and build relationships, and to observe the running of activities. And then lastly, we received written feedback on the first draft of our manual from a number of green space staff working at 2 different organisations. So it was really a very iterative process of testing and refining based on the views of participants with experience and knowledge of the issue. Here's a breakdown of the number of one-to-one interviews we conducted. I won't go into this in detail, but you can see that overall we conducted 45 interviews with Green Space Programme participants, 17 with staff, and 18 with wider professionals working in policy, commissioning, and referral roles. And all of this data fed into the development of the documents that we'll be discussing. And here's just some demographic information on the Green Space Programme participants, so people with lived and living experience that we spoke to. You can see that there was kind of quite a wide range of areas across Scotland and a variety of different Green Space Programme types, which is really important. And here's our refined framework, which the manual structure is based on. If I could just ask you not to share this outside of today's event, because we're currently writing up a paper for publication which presents the refined framework. And this is kind of how we've adapted the existing work that Wendy did to be kind of more suitable for practice guidance based on a rigorous process of testing. So the framework kind of outlines how programs can be effective and the important components that can lead to positive outcomes. And one of the key changes we've made is that you can now see that the structure kind of moves sequentially from pre-program planning through to service delivery and then through to how to provide ongoing and continuous support. So you can see that it moves from kind of left to right in that manner sequentially, and hopefully this is quite useful for planning and implementing programs. And the final area to discuss is the work we undertook to develop the outcomes and evaluation briefing documents. So this work had 2 phases. For the first phase, we reviewed 290 academic papers and we extracted outcomes and outcome measures from each of these. We also asked participants what the key impacts of a green space programme were for them, and we synthesised this qualitative data with the literature review data to create an outcomes framework or a list of outcomes. I'll share the outcome framework shortly in future slides, but just to give you a wee idea of how we kind of did that. So for the second stage of this work, we then asked participants their views of different evaluation methods, and again, we'll touch on that more shortly. So we thought it would be good now to provide kind of some slides which show different aspects of the main manual guidance and the evaluation and outcomes briefing to give you some idea of what it looks like and the structure. So after the meeting, as Wendy said, we'll share these documents around, but as they're not kind of currently available, it won't be possible for you to really follow along while I'm going through different sections, sorry. So I appreciate it might be kind of challenging to exactly envision what these documents look like at the moment, but hopefully sharing some sections will give you a bit of an idea. So we'll start with the main guidance manual document, and as I've said, this was kind of the primary output around how to plan, implement and deliver green space programs for this population in an evidence-informed way. So at the start of the document, there's a section called Program Planning, Design and Focus, and this section goes over some of the initial considerations when you're planning a service to ensure that it's appropriately designed to meet the needs of the target audience, as well as kind of appropriately aligned to a service's context and their resources and their expertise. I'm not going to go through all of this in detail, but I just want to pick out a few key points briefly. So if we focus if we focus our attention on page 4, I've kept that in my notes from when we were going through that and people actually had the documents. So rather, the in this kind of section, we discuss a little bit around the participant group, because we know it's really important to understand who a program is aimed at and what their needs and experiences might be in order to ensure that the intervention is safe and effective. On the slide there, you can see a little diagram in relation to upstream and downstream support to encourage services to think about how to structure a program according to where someone might be in terms of their kind of recovery journey and their substance use. Um, and then we also outline considerations around the type and level of expertise required by staff to safely operate different types of programs. We're aware that different types of programs will require different levels of expertise in both outdoor skills and mental health and substance use support. And we've highlighted kind of three broad types of programs that you can see on the slide there, in terms of how explicitly they aim to provide mental health and substance use support. On the least intensive side, there are kind of informal community groups, which are based around enjoyable activities being undertaken outdoors without really an explicitly therapeutic focus. Then we have kind of more therapeutic programs, and they'll be encouraging things like goal setting, guided reflection, mindfulness, and maybe providing some more intensive one-to-one support. And then at the kind of top end, in terms of expertise required, there's outdoor therapy, where therapy is actually explicitly undertaken in an outdoor space by a trained mental health professional. And we've provided in the manual some guidance around the minimum levels of training and expertise required for each level. So on the slide here, I just thought I would show you a wee graphic that we have in the manual, which kind of summarizes all of the key considerations that we discuss around planning. And hopefully this can be used by practitioners as a bit of a guide to think through how to develop programs in a way that's aligned with the evidence. And then the next section of the manual that we have kind of goes through risk assessment and making sure organizations are aware of the potential risks and how to mitigate them. It's really important that organizations are aware of this and plan for this and don't assume that kind of nature-based interventions are a risk-free activity, specifically when supporting people who might have kind of mental health and substance use support needs. We developed a flow chart to help organizations and practitioners think through this. You can see it on the slide there. I won't go through it in detail, but once we share the documents, you can have a little bit of a look. But again, it's just trying to structure thinking through these considerations and ensuring that organizations are aware and kind of mitigating and accounting for these factors. Here you can see we've provided specific program theories for different types of risk. So we have person-specific risk relating to kind of people's mental health and support needs, and then activity-specific risks and environmental risks around kind of using specific tools, ensuring you don't harm the environment. So again, we've kind of split it up and provided some quite hopefully robust guidance. In the main kind of bulk of the manual, which you can see on the slide there, section 3, we go through service delivery. So it's moved from planning into service delivery. And this really lays out why green space programs and how they can be successful in supporting individuals experiencing problem substance use and mental health. I won't go through this in all the detail, and you can have a look in your own time after the event. But I just thought it'd be good to kind of share one program theory to give you a bit of a taste. So this program theory is called having a purpose. And you can see there the if then leads to statement, the program theory laid out. So the context, the if, are that a program should be person-centered, should allow enough time to be spent on it, so it should be long enough and should have an element of structure. And this will then lead to the mechanism of a sense of routine, feelings of purpose and responsibility, feeling valued, and a belief that activities are meaningful. And then our outcome should be for people to have improved self-care in daily life, improved self-esteem, and a positive sense of identity, as well as increased kind of goal setting. So below each program theory, we actually then lay out each context, mechanism, and outcome in more detail, and we provide kind of practice examples for organizations to think through how they can achieve these evidence-based contexts. So again, just thinking about how we've made it, we tried to think about how to make it as practically oriented as possible, but still really underpinned by an evidence-based and robust framework. And then at the end of the manual, we then move on how organizations can provide ongoing and continued support, when a program ends. We know this is a really important consideration because we need to ensure that individuals continue to be supported once a program finishes to ensure that the benefits experienced translate into longer term impacts. Um, Based on what participants told us, we provided guidance on a number of different routes to consider, including linking people with community spaces, encouraging fostering skills and confidence for people to enjoy nature independently, as well as kind of linking to more formal mental health and substance use support services. I won't go through this in detail, but you can see on the slide there the kind of variety of different options which we lay out in the manual. So let's move on to discuss the outcomes and evaluation guidance, which I've kind of touched on how we developed that. We were aware how challenging evaluation can be for a number of reasons, so we wanted to provide some guidance based on our data. Here is the kind of outcome framework which I discussed previously, which was kind of really rigorously and iteratively developed. So hopefully this provides a bit of a starting point for organizations when thinking through what impacts they might want to evidence through evaluation. Um, in this document, we also talk about how outcomes relate to kind of recovery capital and how green space programs can foster recovery capital, which you can see on the slide there. We found that actually when people were discussing the kind of impacts they experienced through taking part in a green space program, this really closely aligned with the literature around recovery capital at the individual, social, and community level. And this kind of suggests that green space programs have a role in fostering this kind of recovery supportive resources. So hopefully providing this can be a bit of a useful lens for evaluations, for program evaluations. So we provide then some detailed guidance on each evaluation method, which we ask participants about the feasibility and acceptability of. So you can see there that we tested kind of people's views of self-report scales, qualitative methods, observational methods, and creative methods like journaling, art, and photography. And we wanted to know, how people perceived them, what were the advantages and challenges, and then we lay this all out in the briefing document. And I just wanted to provide a wee example of one of the self-report skills that we looked at. It's called a well-being wheel, which is developed by our colleague Hugh Asher and is specifically tailored for nature-based interventions with those experiencing substance use challenges. So we ask participants their views on this, and then we provide guidance as well as advantages and limitations, and how to use it based on this data. I'm not going to go through all the advantages and challenges, but again, you can have a look when we share the documents. So just to summarize this section very quickly, because I'm aware that I'm kind of running over my time a little, I just wanted to highlight a couple of points about why the approach we've taken might be helpful for guiding the evaluation of green space programs. So as I said, we've developed and tested an outcomes framework in a really rigorous way, including 80 interviews and analysing 290 academic papers based on green space programs. And this is hopefully a useful starting point for structuring evaluations. And secondly, I think it's important to highlight that we've presented guidance on evaluation methods based on the perspectives of green space program participants themselves. And this is often something which isn't really done, but it's really important for designing collaborative and participatory evaluation approaches. And just to finish off, I wanted to kind of touch on the perspective of green space program participants and what they said makes a kind of meaningful and appropriate evaluation. So the recurring themes were things like having a choice and input into the methods used and being able to express the impact of a green space program in a way which felt kind of appropriate for them. So participants didn't want to feel like they were being examined or tested, and they valued informal and collaborative approaches. And whilst they recognise the kind of value of self-report skills and that they can have a place in evaluation, they discussed the importance of not over-relying on this approach, which they actually sometimes felt might produce less meaningful data in some senses than creative or qualitative approaches. So this is quite important because maybe it can help push back against the culture among some funders of relying solely on quantitative approaches because we're highlighting what makes evaluation meaningful and appropriate from the perspectives of people taking part. So I'll just stop sharing my screen. Thank you. That's all from me for now.
Great, thanks very much, Danilo. We'll move straight on to Mo, who's going to now talk about the third document. So Mo, if you want to share your screen. In the meantime, if anyone's got any specific questions for Danilo, then do please put it in the chat, or you can wait until the Q&A at the end.
Thanks, Wendy. Just bear with me 2 wee seconds. Oh. Everyone see that all right?
Yep, that's good to go.
Perfect. So as Wendy and Danilo just mentioned, I'll be talking about our buy-in toolkit. So simply put, buy-in refers to the trust and confidence in green space programs that's built by support workers, referrers, link workers, and other people working with potential participants of green space programs. Of course, the people involved in supporting a potential participant on a green space programme will depend on where the programme is, who's running it. So, for example, participants may be supported by their support staff to attend an internal programme, or they may be directed to an external programme. Regardless of the pathway, we designed the buy-in toolkit just to make sure that referrers and link workers, or whoever it is that points somebody to a green space programme, has a document that then means that they can support people onto the programme in a way that's most effective. How do we actually achieve buy-in? So the next section within the document, of course, we don't have the documents in front of you. However, when they are sent out to you, you'll be able to see that the next section discusses how buy-in's achieved. We primarily outlined things such as time, space away from issues and challenges. Green space programs allow people to learn skills and develop confidence. It allows people to build connection to others. It improves mood, physical and mental health. And green space programs typically differ from other treatment modalities that may be offered to people with problem substance use or mental health challenges. So as I explained, the purpose of the buy-in document is to provide a resource and support for practitioners, and refers to structure initial conversations with potential participants. So how are green space programs actually perceived among prospective attendees? We explored how green space programs are perceived through 4 focus groups with a total of 17 participants. All were residing in temporary accommodation. They had no experience of green space programs and were asked to discuss what their perceptions of them were. 8 perceived benefits emerged, including providing space to reflect, connecting to nature, confidence and personal growth, developing skills, nature as a non-institutional setting, supporting recovery and quality of life, encouraging social connection and improving mood and well-being. So overall, that data demonstrated a high level enthusiasm for nature-based activities, despite the fact there was no or limited prior experience of green space programs. And these findings can be drawn upon to secure buy-in by showing highly marginalised groups, including people experiencing homelessness and or substance use challenges, to see the potential green space programs have to provide potential benefits. This is just a part of the toolkit here, just to give you a wee example of what it will actually look like within the document. We do give quotes here from the focus groups, as we felt like that really drove home the impacts that the green space programs had, or what the perceptions of them were. The quote here, sitting in a room and someone just saying, well, if you do this and if you do that, well, that might work for you, but not for other people. Whereas nature, I think for mental health is beautiful, was a really good quote, just to show how nature is perceived as a non-institutional setting for people who maybe don't want to attend typical treatment modalities. So how can you ensure the suitability of a green space programme for a potential participant? In this section of the document, we provide a list of potential barriers that were highlighted in our research, and we put forward suggestions on how these could be addressed with prospective participants. This includes establishing expectations and potential barriers for participants prior to attendance, to ensure that individuals feel adequately supported and more likely to engage. Barriers include things like mental health and substance use support needs, transport, access to equipment, demographic considerations such as ethnicity and gender. All of these barriers are important to consider to make sure that the participant that we are linking to the Green Space programme are able to attend and engage effectively. The next section discusses what benefits Green Space programme participants report. So once again, we use diverse quotes from those who have participated in Green Space programmes. These can be useful to secure buy-in as they demonstrate the benefits from those who have attended, and they can be presented to those who are yet to attend. It is important that you use quotes from a range of demographics to appeal to a wider audience. Here you can see the short quotes that we have chosen, and these will all be included within the toolkit as I explained previously, and you can have a look at them once it's sent out to you. And finally, we presented some case studies to give real, tangible examples of Green Space programmes and their ability to support wellbeing and recovery. For example, here we presented a testimonial from Craig, that's using an alias, that discusses a referral pathway to a Green Space programme. Things like this can be particularly beneficial for participants who are unsure about the referral process to an external or established programme. We also developed some videos from our lived experience advisory group made up of individuals with lived experience of substance use and mental health challenges who had utilised Green Space programmes. The objectives of that video is to show that potential participants during initial discussions can visualise how a Green Space programme might help them. So this is just an example of what the video will be presented like within the document. We appreciate that obviously with links and things like that, when a document is being printed, it might not be the most accessible. So we will make sure that when this is sent out to you, all of these links can be accessed. Our last slide here, this is actually a painting that we had commissioned by an artist to put forward essentially a creative way to display Green Space programmes and their benefits. We thought this would be a nice way to end the presentation, just so that you can see that there are other creative outputs that are happening from this project. And to summarise, the toolkit was designed to support referrals for Green Space programmes amongst people with experience of poor mental health and substance use challenges. Buy-in can be secured through use of testimonials from those with similar life experiences and from those who have benefited from Green Space programmes. And it's important for those supporting participants to consider barriers to attendance. This toolkit can make sure that all of these things are addressed. Thank you for your time, and if you have any questions, just feel free to fire them into the chat and they can be addressed after.
Great, thank you, Mo. So as Mo says, if you've got any questions specific to that document, please do pop it into the chat or wait until the end. We'll have plenty of time, I think, for Q&A. And we can hand over now to Josh, who's going to talk through the participant-focused document and the fourth document that we want to share today.
Thank you. Can you see my slide, Wendy?
Yep, can see it fine.
That's great. So good morning, everyone. My name's Josh. I was leading the patient and public involvement and engagement on this project. It's great to see so many people here. So I'm here to talk about a single straightforward idea called the thoughtful self, an idea that grew out of our work with the Lived Experience Project Advisory Group, and it aims to support the design and delivery of nature-based programs for people with experience of problem substance use. So where did the idea come from? So our project advisory group, or LEPAG, consisted of men and women, most of whom were in abstinence-based recovery, who also attend 12-step meetings. That becomes important later on. Our group met 4 times over the course of this project, and we were fortunate to engage in nature-based activities alongside the study design tasks that we were supposed to be doing, including foraging, building fires, making ointments, and forest bathing. It's good work if you can get it. So given their personal experience of substance use, early recovery, and varied use of nature for well-being, they were very well placed to support this study. So immediately drawing on that experience, they recalled how hard it was to stay engaged with a new intervention while you're still wrestling with fear, cravings, low mood, self-doubt. In these workshops, the group told us something striking. Headline claims such as nature is good for you sounded nice, but they didn't feel solid enough to carry them through the darker days of recovery. By contrast, they said, there's long-standing evidence for 12-step programs, therapies like CBT, millions of success stories, meta-analyses, clear steps to follow. That evidence builds trust and makes it easier to buy in. So the LEPAG posed a question. How can nature-based programs offer the same sense of credibility, the same backbone of proof, so people will stick with them when things get tough? Their answer centered on a progress we described as sense-making. So defining the thoughtful self. Out of those discussions, we coined the term thoughtful self. In plain language, the thoughtful self is the part of you that says, show me it works. It's the evidence-making, meaning-making voice that 1, forms a hunch. Maybe a 10-minute walk will lower my anxiety. 2, tests that hunch. 3, records the result. 4, checks whether friends felt the same. And 5, decides whether to keep going. One LEPAG member put it quite succinctly. I need even a tiny sign, better sleep, calmer thoughts before I'll commit. Otherwise, I'll drift. That is the thoughtful self in action. Why it matters in early recovery. Early recovery is biologically noisy, socially fragile. Sleep can be patchy, moods swing, relationships can be strained. In that turbulence, even the smallest confirmed improvement carries huge weight. When the thoughtful self sees a pattern, say stress falling from 4 to 2 on a simple 1 to 5 scale after a woodland walk, it files that as evidence. Confidence rises. The person shows up again next time. If no improvement is detected, interest fades. In other words, the thoughtful self is a gatekeeper. When its trust and engagement climbs, ignore it and participation slides. Connecting to existing theory. So the thoughtful self maps neatly onto several established ideas. Aaron Antonovsky called it a sense of coherence, the need for life to feel understandable, manageable, and meaningful. Self-determination theory highlights autonomy and competence. The thoughtful self meets both by letting people choose and then prove that their choice works. And as Danilo had already highlighted, recovery capital theory reminds us that personal resources like confidence in one's own evidence help sustain long-term change. So it's not brand new psychology. It's a practical wrapper for familiar mechanisms distilled directly from lived experience. So turning that concept into practice. Working with the LEPAG, we produce 2 tools to serve the thoughtful self, a brief manual and a simple diary. The manual explains why nature might help. Crucially, it invites participants to run small experiments. Start with a silent walk, rate how you feel, repeat if helpful. The diary offers 1 to 5 mood craving scales plus short reflection prompts. Nothing overly laborious, just enough to capture those tiny signs of progress the thoughtful self needs. Participants are encouraged to share their results with peers, and this peer validation will make the evidence feel more real. Program structure echoes the advice from LEPAG. So you can begin solo because early trust may be thin, then paired tasks, and finally small group projects once confidence grows. Silence is allowed, botanical expertise is optional, and nature's big selling point. It's free, it's abundant, is kept front and center. A brief illustration would be picture someone 6 weeks sober, wrestling with late afternoon cravings. They try a 10-minute walk. They mark craving at 8 before and 6 after. They do the same the next day. Craving drops to 5. That a peer reports the same pattern, and the thoughtful self now has personal data and social proof. The walk becomes routine, not because a professional worker insists, but because the evidence is self-owned and peer endorsed. And implications for service delivery. So build easy metrics into every session. If you can't show change, the thoughtful self stays unconvinced. Encourage storytelling. Lived testimony is powerful secondary evidence. Respect a graded exposure. Let people test the waters alone before expecting group enthusiasm. And train facilitators to notice and reinforce thoughtful self moments. In doing so, we give nature-based programs the credibility edge that they may have lacked and help them sit alongside more established treatments. So to summarize, the thoughtful self is the inner evaluator that asks for proof. Our lived experience group highlighted its importance for sustaining engagement, especially where motivation may waver. And a manual and diary now have operationalized this idea, offering practical ways to collect that proof. By designing the thoughtful self, we make nature-based interventions more persuasive, more evidence-rich, and ultimately more useful for people rebuilding their lives. Thank you for listening. And
Josh, just to say that your second slide, and I don't know if it for other people, but it didn't move on to your second slide.
we will be sharing these at some point.
Yeah, so I just wanted
Yes.
to give people the opportunity to see the things that you were talking about in the different pages that are included, and just the way that it's laid out, so it's very user friendly. And like Josh says, we'll share this document with everyone afterwards, but just to give you a snapshot of what some of the pages look like.
Thank you. Right.
Thanks very much, Josh. Right, I am now going to finish up for us and talk very briefly about what we're going to do now. So it's really important to note that these ideas that I'm going to speak about are really in their infancy as we come to the end of the project. The project only finishes this week, so we're only now really thinking about drawing together everybody's feedback, thinking about how the project ran, thinking about all these important considerations, questions that are not yet answered, and thinking about where the project actually goes direction-wise now, thinking what are actually the key priorities. So I wanted to cover that briefly just now. So first of all, we really need to think about prioritizing partnership working, situating our work within the current landscape. So there's a lot that has gone on across the Green Health Partnerships, across the Green Health Learning Network, across different networks across the UK. So although we've worked in Scotland, there is a lot going on other places as well. And I know that there are people here in the call today that are from different sections of the UK and are also involved in some of the amazing work that's going on. Across different organizations, but there's also researchers that are working on similar types of work around this nature-based programs for health and different population groups, and that might include existing guidance and developing guidance that can potentially help in improving access and reducing inequalities. So we need to ensure that we're not duplicating work, and that we actually know how our work maps onto what is already going on. So there's a lot of work that's going on around green prescribing pathways as well. Although we have the buy-in document, our work doesn't focus specifically on green social prescribing. So again, how do we integrate or fit our work into these conversations? How does our work align with those? How does it contribute? How does it run alongside it? With what already is being done. So collaboration and wider discussion is key for us looking forward. Secondly, need to prioritise the voices of people with lived experience. So we know that interventions need to be acceptable from the point of view of people with lived experience and those who will be the recipients of the intervention. And ensuring this will help address the hidden barriers to access that might not be visible yet are essential to implementation. And we've spoken about some of those today, and we go into a lot more detail around those in the documents. But given the centrality of lived experience in our work, our guidance could be really helpful in moving this kind of consideration of people with lived experience being central. And if we're wanting to take our guidance manual forward as an implementation tool that has people with lived experience central, we need to think about piloting it and testing it actually for its acceptability and feasibility in different areas. So again, discussions with interested parties around where we could do that will be key for us. And finally, outcome measure and evaluation discussions need to be prioritised and continued. So Danilo spoke a lot about the outcome measure work that we've done. It's really rigorous what we've done, and we've had really great feedback about it so far. But through our work, we really found that there is a need to integrate more novel approaches and thinking about the acceptability of different evaluation measures from the point of view of participants themselves. As Danilo mentioned, that's not something that's focused on an awful lot. Often evaluation is something that practitioners decide or researchers decide in terms of what the process is going to be. So actually asking the participants themselves how they feel, how they respond, does it make sense to them? It's really important to include that, and that's something that we've prioritized through our work. So but through this, we've also found that, or we've also heard that standardizing outcome measures and evaluation approaches is something that could happen as well. So to explore this, we again need to test the feasibility and acceptability of our approach and our guidance documents, but we also need to consider how it fits into what is already being done and where it needs expanded. So where, although the work is rigorous, there will always need to be refinements and expansions depending on feedback when we actually test it in different areas. So these are the key areas that we're wanting to work on going forward, or that we're building future funding ideas around. But we're very interested in hearing feedback once you look at the documents, once you've spent time reviewing them and seeing if they make sense to you. We would love you to get in touch and let us know what you think and any interest around using them as well. So I just want to give a quick note of thanks here at the end. Thank you to all the people who contributed their time and insight to the work, particularly staff and participants from the Venture Trust and from branching out South Aberdeenshire. They provided extensive support with interviews throughout the project and also guidance around the document review as well. But thank you to all the wider participants. Danilo obviously spoke and provided a bit of information about the breadth of who we spoke to across different health boards and different organisation types. So we can't thank people enough for all the work and time that they gave to the project. Also, the advisory groups that we had on the project. Thank you to the Chief Scientist Office. They funded the project that we've spoken about today. And thank you, of course, to the rest of the research team, both those that are here today and those that are not. Thank you to my colleagues who have spoken today, and also thank you for listening. We have plenty of time now for Q&A, which is great, and which was what we wanted to do. So please do pop your hand up. Jess, you can maybe identify whose turn it is if there's multiple people that are wanting to ask questions, or do feel free to put your question in the chat, or feel free to email us afterwards. As I've said, we'll be sending the documents around to attendees as well as the link for the recording itself. Do feel free to share these with colleagues and with anybody else who might be interested. So thanks very much for listening, and happy to answer any questions.
Thanks, Wendy. There's one question in the chat if you want to pick that one up first, from Jeff, and it says, has there been any investigation into seasonal factors and continued participation? I'd imagine that it's easier to make a persuasive case for nature-based programmes in spring and summer versus the winter months where poor weather, less daylight, SAD, etc. come into play.
Yeah, I think that's a great question. So that, and thinking about weather, that's really tapping into this idea of what context a program might work or not work in. So weather is, as we know, it's unavoidable and it's uncontrollable. So what we can, or what programs could try and do or look to do, and we include this in the manual, is think about how could that be responded to ensure that it's as comfortable as possible for participants. So, for example, there should be shelters, there should be equipment, or there should be clothes that participants are able to wear, things like boots, for example. There are some organizations, some programs that will be able to have their own kit that they can share with participants, but really just ensuring that people come prepared for the weather as well, because we have people that don't have experience or don't have a lot of experience with what it might be to be outside during groups, might turn up not wearing appropriate clothing. So it's about that pre-planning stage of people being aware of what the challenges, weather, for example, in this context, could be, and also what the group could do to try and mitigate some of that. But it is, we do acknowledge that if it is pouring with rain, it might be less enjoyable than if it was in sunshine. But actually, from what we've heard and when we spoke to different people, there does seem to be there isn't as much variability as you might think, as long as they feel that they've been prepared for the challenges.
Thanks, Wendy. We've got another question in the chat, but I can see Kat's just put her hand up. So Kat, do you want to speak to yours first, and we can pick up in the chat? Danilo, maybe you can. Thanks.
Yes, thank you. I was just going to say, so my name's Kat. I work for Venture Scotland. I know you've had Venture Trust, I think, involved in the research, and we're actually separate different organisations. But we run an outdoor-based intervention for people in recovery in Glasgow, which is very outdoor focused and have done for the past 3 years. So just to say, a lot of what you've been talking about today definitely resonates with people that are on the ground kind of doing this work. And yeah, I was just wondering if there's going to be any more sort of forums for people or more research with people that are already kind of working in that field. It would be great to kind of connect with other organizations already doing this or who want to. I guess we've been our program's been running for the last 3 years now, so I have quite a lot of evaluation and experience from doing so, and it would be great to share that with the team and for any other organizations that are working in similar ways.
Yeah, thanks, Kat. That's something that we have been speaking about in terms of how we might want to share the work widely in a sustainable way. So one of the things that we're doing is developing a website. And one of the things that we were thinking of potentially having on that website is somewhere that people who are wanting to build relationships or share what they're doing, is that they could potentially post on that and share their details. I think it's always going to be a challenge trying to build relationships and share documents and connect people. And it's definitely something that we've come up against, is that there's so much amazing work happening in different pockets, both on a larger scale, bigger organizations, and very small community-based groups. And how do people meet each other? How do people know what's going on across the breadth of the country? And that is a challenge. But thinking about moving forward as well in terms of what our future funding could look like, something that we're thinking about potentially is things like the equivalent of maybe like an open day where people could all come together and meet different organizations, different groups. If people wanted to, I guess, showcase what they were doing, that they could be part of that as well. So that is, as I said earlier, our ideas moving forward are definitely in their infancy, but it's something that we're really keen to do, is try and build on that interest and motivation that seems to be so prevalent within this field. People are really motivated to push it forward and combine and learn from each other. So I think that it would be a great opportunity to build on that. And certainly if that's something that you yourself or anybody else in this in this group is interested in doing and staying in touch with us and being involved kind of going forward, then do just give us an email and we can add you to our sort of list of networks.
Okay, thank you.
Thanks both. Lorraine, do you want to come in next?
Hi there. Firstly, thank you so much for that. I'm so excited to hear the sort of breadth and depth of the work that you've done, and I really haven't seen sort of green space social prescribing talked about in such a thoughtful way. I run a really small not-for-profit called Edinburgh Community Yoga, and we run sort of trauma-informed embodied programs for women in recovery and with CPTSD. And I guess my question, we're at a point where our organisation is really under threat. We know that the work that we do is really needed, and we know that it works, and our evaluation sort of replicates everything that you've just talked about, and particularly around the outcome measures, where we used to try and use the well-being wheel, and people talked about that feeling really re-traumatizing. And we've worked really hard to try and develop more qualitative and trauma-informed ways of gathering data and evaluation. But I guess my question is, how do you imagine that with the work that you're doing, that sort of sustainable funding models can be developed so that all the organisations who are trying to do this work and similar work can deliver it in a way that offers follow-on for people, so we're not just putting in short-term programmes that then end and cause distress for people in the end, but also so that the organisations like ours can work on sort of long-term planning and being able to implement projects on a longer-term basis rather than being dependent on short-term small grants. So yeah, I don't know if you have an answer to that, but I guess I just wondered.
Yeah, I think that's really key. Thinking about funding, what I need to say, and I mean this isn't going to be a surprise for anyone, is that unfortunately we can't change the funding landscape, and the funding landscape is really, really challenging just now, not just for nature-based approaches, but for a whole host of programs of approaches. So I think that what we need to think about is what can we do within the funding landscape, and I think that unfortunately there probably will be, at least for the immediate future, the need for continued applications to short-term funding. What we're keen to look at and to really work out is how might that change, how, and speaking to people that might hold the purse strings, talking to people like commissioners, talking to people who maybe have more of an insight into what are the sticking points, what are the challenges around these sustained funding, and is there anything that can be done? And that's going to be an in-depth exploratory piece of work, and something that we are really keen to uncover. In terms of the work that we're doing, what we're trying to do is although short-term funding isn't ideal, what we're trying to do is make that easier for organizations, for groups. So for example, taking the outcomes document for just as an example, is that sometimes what we hear is that funders or whoever might say, well, what was your rationale for choosing the outcome measures? What your rationale for the evaluation, or what is your rationale for that? And what we're trying to do is provide this empirically evidenced bit of work that organizations can then draw on and say, well, it's not just us that decided that we were going to show this. Actually, we're basing our decisions on this very rigorous piece of research that has been done, and where there was many different people spoken to. There was literature that was synthesized, and it was all combined and analyzed to provide this document that is hopefully going to provide this empirically sound bit of work that people can use. And what we're hoping is that it will then be more convincing, I guess, for people that might want to know where those decisions are coming from in terms of how to show benefits. But also what we'd be keen to think about as well is that this type of guidance document, particularly the main guidance document, would allow organizations to ideally either train staff, train peers, train people that could take on a role of, I guess, peer work or maintaining or sustaining these types of approaches. So for example, if you've got an organization, and we're aware it wouldn't work in every setting, thinking about staff expertise and going back to the necessity of that, but thinking about organizations that might want to put in a few gardening boxes or things that, a greenhouse or a community garden, something like that. If there is the ability to use our document to train a sort of peer-led approach, then that suggests that people could have that that approach or that program as an ongoing thing, that once it's up and developed after the initial sort of funding period and through that peer-led approaches or sort of low threshold, I guess, approach, then it could be a lot more sustainable than having to apply for continued funding, getting new staff in each time, and essentially building a project from scratch each time. So I know that doesn't sort of, it's not the sort of answer of, yeah, we're, you know, that we all want us of changing the funding landscape, but it is considerations that we're having in terms of how do we make things a bit easier for organisations.
No, thank you. And I think the way that you've brought that work into the sort of practical and real world is really unusual. So thanks.
Thanks, Lorraine. So I know that we've got quite a few comments in the chat. Is there any, Jess, that I could answer quickly? I mean, we can get back to people and answer these after the session. I know that we've still got sort of 10, 15 minutes, but there are quite a lot. Is there anything that jumps out?
Danilo has done a good job of answering most questions, so but definitely
Great.
some good comments for you to read afterwards, Wendy. Maybe one that's maybe more a suggestion from Nicholas is perhaps sustaining an online community of practice could be a good outcome from this project. And then helpfully Rachel's shared a link to the new Green Health Learning Network hosted by Public Health Scotland, which might be of interest to people, and there's a link there. So yeah, don't know if you've got any thoughts on that.
Yeah, I think that would probably be the network that I would suggest. People that are not from Scotland, from other parts of the UK, please do share networks that you have as well that we might not be aware of. I think that for us, one of the things that we're quite passionate about is ensuring that our academic work is combined with the work that's on the ground. You know, we might be the ones doing the research, but you're the ones that are working on the ground. You're the ones that have insight into what's happening, the challenges and things that we need to be aware of. So it's about, for us, it's about how do we build that community that ensures sharing and knowledge transfer across different I guess different areas of work, whether that's in practice or research. I think in one of the comments that I made, or one of the answers that I put in the chat box, was that it's really important to say that this is the end of this project, but not the end of the wider project. It's just the end of this period of funding. And there are, like so much research and like so much areas of interest, once you do one thing, it opens up the pathways or potential for lots of different directions. So there's hopefully going to be a lot more of this work. But again, like we've already spoken about, we're funding dependent as well. With the work that we do, we have to apply for funding too. So it is dependent on that and the scope of what the funders will are asking for. But yeah, there's definitely a lot to do, and we acknowledge that. But I think that is exciting as well to hopefully kind of continue this and build on the momentum.
Thanks, Wendy. I think we've covered off all the questions in the chat, so just lots of really positive comments and all the good work you've been doing.
Great. Okay, well, we're still got about 5 minutes or so to close, but if nobody else has got any other questions, then that's fine. If you do think of any questions and you want to get in touch with either myself or Danilo, Josh, Mo, then you can email me. I can send contact details onwards. I'll have a look at the meeting chat and just add in anything additional, but I can see that my team have done a really great job of answering most of the questions. But yeah, it'd be great to stay in touch with anybody who is interested. Please do keep an eye out for the documents, and we would love to hear feedback from you. I think, as Danilo said, it'll be a lot easier, hopefully, to really get a feel for the work, the practical work and the guidance work when you look through the documents and kind of see what Danilo and Mo and Josh were talking about. So thanks very much for coming, everybody. And I don't know if Mo, Josh, or Danilo have anything that they would like to finish on or add.
Nothing from me. Just thank everybody for their time. And thank you for all the nice comments in the chat too. It's really appreciated.
Yeah, nothing extra to add from me. It's just great to see so many people. And yes, please do get in touch, everyone.
Yeah, absolutely. Same my end. Thank you.
Great. Okay, thanks everybody. Speak soon.